Thank you for staying with us on the news this hour. Let's talk health matters. The Plateau State government has confirmed an outbreak of Lassa fever affecting 7 local government areas with 11 positive cases and 4 deaths recorded since December 2025. The State Commissioner for Health, Dr. Nicholas Bamlong, disclosed this at the press briefing at the Ministry of Health in Jos, where he provided an update on the outbreak and the state's response effort. He said the state received first alert on the 20th of December 2025 following a case from the Kwampan local government area and immediately activated the incident management team. He also explained that the 2 cases were initially confirmed, prompting extensive contact tracing. The commissioner noted that the outbreak has resulted in 4 deaths across major health facilities, including a health worker. Dr. Bamlong noted that 109 contacts are currently under follow-up as health authorities intensify surveillance and response. And for more on this, let's speak to the Plateau State Commissioner for Health, Dr. Nicholas Bamlong. Doctor, thank you for joining us on TVC News at 10.
Yeah, good evening.
Good evening. From 69 contacts earlier to 109, this appears to suggest an ongoing transmission. Can you confidently say Plateau State has this outbreak under control?
Yes, by the grace of God, we have tried what we can. Currently, like I mentioned, we are doing a lot of contact tracing. We are also trying to see how we can activate a lot of, those that are suspicious, because as it is today, we have 4 people that are on admission, 1 confirmed positive, while 3 are still awaiting their results. But of the 3, 1 of them has become very stable, while the others are still. But truly, I would say that it's under control because we've taken some measures to ensure that people are well enlightened. We've also tried to see how we can go as far as all the places that we have identified, the local governments that are involved, because right now we have about 5 local governments that are having this outbreak. But currently, we don't have all the active cases from there, like in Kwampan. At least it's under control. In Lantan South too, but we have 1 case positive from Mangu local government, and also the suspicious ones are from Jos North and Jos South. So, but in all honesty, I would say that we are trying to contain as much as possible the spread.
You've assured the residents that drugs and personal protective equipment are available, yet we see that a doctor is currently on admission and others may have been exposed to this. How do we reconcile these assurances that you've given us tonight with the situation on ground when even medical professionals are affected too?
Yes, because of the way it started, some of the patients presented a little late. I won't say too late, but the government, together with the Nigerian Center for Disease Control, have been able to ensure that drugs are made available. The state government gave approval for us to purchase some medications, and also we have been distributing the personal protective equipment to health facilities, because for a doctor to come down with this disease, it means that other health workers are also at risk. And currently, we have a nurse that is also being suspected at Plateau Specialist Hospital. That too, we are monitoring, even though some of her symptoms have subsided. We are waiting for her results. And so, but truly, the government has taken it as a matter of emergency, and we've been able to buy some of the PPEs sent to these facilities, the drugs that initially we are having some challenge. But we were able to buy some, and recently the Nigerian Center for Disease Control gave us some supplies, which we've also deployed to the facilities. And they are taking good measure to ensure that anyone that is suspected or is on admission is given these medications.
Let's talk about capacity beyond the healthcare professionals and how adequately equipped you say they are to handle a possible rise in cases. We're not praying for that, but is there a clear plan to expand treatment centers if this outbreak worsens?
Yeah, what has happened is that, we have some tertiary facilities in Plateau State. And so at the Jos University Teaching Hospital, at the Bingham University Teaching Hospital, Plateau Specialist Hospital, these are centers that have isolation centers for any of these kind of cases. And so I would say that we have been quite prepared. The facilities have been well gingered to ensure that any case we see outside of these places is referred immediately. And we have specialists at all of these places that are also, we have infectious disease physicians that are managing these patients adequately. So we have the capacity to take care of this illness in this Plateau. So our only problem is the testing capacity, which we have to send samples either to Abuja or to Bauchi. And it's one of the reasons why over this last year we have been clamoring that if we could have a center for testing. This will help us to ensure that those that are suspected are tested early, and when results are available, we can be able to commence treatment immediately. So that's the only place that we're having some challenge. But in terms of human capacity, it's quite adequate. In terms of space, it's quite adequate.
Okay. And for the purpose of public enlightenment, Doctor, talk to us about the early symptoms of Lassa fever and, the immediate actions to take once these symptoms appear individually.
Yeah, we've always advised that when you have a fever that is, you've treated malaria, maybe you've treated respiratory tract infection, and the fever is still persistent, it is enough sign for you to start suspecting. Similar, maybe you have body pains, headache, sore throat that, you've taken antibiotics and still it's resisting going. So that is a sign that something might be happening. And the ultimate thing is that sometimes you start bleeding from orifices. You might bleed from either you start urinating blood or you start vomiting blood or from even the private parts. So in that case, it means that it has gone a little far. And that is when sometimes some of the patients will present. And so we advise that once you have these early symptoms, the immediate thing to do is to report to the hospital and ensure that we also advise, particularly our health workers, to ensure that they have these personal protective equipment when they are examining any patient coming to hospital with any fever.
Plateau State Commissioner for Health, Dr. Nicholas Bamlong. Doctor, thank you for joining us on TVC News at 10.
So thank you so much. It's a pleasure. We pray that you will continue to enlighten the public so that as much as possible, they will also get to know about this illness. And let's try to do the preventive part as much as possible.
All right. We will, as we've always done. Thank you.